All right, so these are our disclosures. Our senior author has several disclosures listed at the bottom of the slide. None of the other authors have anything to disclose. So in the US alone, we know that approximately 500,000 ventral hernia repairs are performed annually. But despite being one of the most common operations performed by general surgeons, the long-term complication rates are unclear, with prior studies in the literature limited by small sample sizes, short follow-up times, and non-US based patient samples that do not account for the heterogeneity of our population. We therefore elected to perform a 10-year retrospective longitudinal study at a single tertiary care institution to track long-term complications following index ventral hernia repair, which we defined as greater than 30 days following surgery, and were classified as hernia recurrence reoperation, major complications requiring emergency surgery, and non-recurrence procedural interventions. 645 patients were included in the final analysis. 10-year survival probability for each of the long-term complications tracked was as follows. There was about 62% recurrence reoperation-free survival, about 90% major surgical complication-free survival, and 78% non-recurrence procedural intervention-free survival. Ultimately, this translates to over 1 out of every 3 patients requiring reoperation for recurrence at 10-year follow-up, 1 of every 5 requiring a non-recurrence related procedural intervention, and 1 out of 10 requiring emergency surgery following index hernia repair. This points to a pressing need for increased national surveillance, including post-market surveillance of mesh implants, in order to target factors that contribute to these high complication rates. Putting this into perspective, if we estimate that about 500,000 ventral hernias are performed annually in the US, then at 10-year follow-up, this boils down to a total of almost 190,000 operations for hernia recurrence, about 110,000 non-recurrence procedural interventions, and approximately 51,000 emergency operations for major complications, which just speaks to the importance of focusing future studies on more effective surveillance to minimize the impact of these complications on both patients and our healthcare system. Thank you.